Good morning, everybody. I come slideless and without packs, just with something called paper, even with a very traditional civil servant thing called a treasury tag. So I'm probably one of the few people in the room that hasn't been to medical school and somebody that doesn't walk around with anything technical. So anyway, I'm quite proud of that, as you can see. Now, come on, that was the most humour you're going to get out of me on Friday morning. I realise I've drawn one of those, conference slots that, it's Friday morning, Mike. But anyway, there we are. I'm up for it. I'm very much up for it. Actually, I wanted to say I'm incredibly honoured to be asked to speak at the Royal College of GPs conference. It's an extraordinary honour for somebody like me to be here. And I was very touched when Claire Gerarda and Mike asked me to come along today. And I know that you are, I read the Guardian front page last Saturday, and I've watched your conference and all sorts of things as the week has gone on. So I realise that you are dominated by an awful lot of issues at the moment to do with reform and money and all of those sorts of things. So in the midst of all of that, it is kind of you, and I hope that you will bear with me in these next 15 or 20 minutes to talk about something probably completely different to all of that. Like most of the country, we revere doctors, and actually it's one of those moments, Mike, where I wish my mum was alive today, because she would actually understand, coming along to talk to a group of GPs, she would just be amazed by it. So thank you. It's a kind of personal best, really. Obviously, you may not feel that by the time I finish, but, I'll give it the best I can. So, right, I'm head of the government's Troubled Families programme, and I suppose the really important reason, and the reason I bit your hand off to come along today, is because troubled families are, without doubt, families and individuals and children who you as GPs will be worried about. There's no doubt in my mind about that at all, and they dominate NHS budgets. That's the long and the short of it. To the Troubled Families programme that I'm leading at national level is about changing the lives of people who, despite the best efforts of many of us in the room in public service over the years, and that goes way beyond the world of health, into policing, into crime, into children's services, into the voluntary sector, all that I have done in my previous jobs over these years, these families simply have not been changed. These are families, of course, who many general practitioners in the community will know and will often have known for more than one generation. I listened to a doctor not that long ago talk about the grandmother to the mother to then the teenage child, all in the same family, all coming into his surgery, and all being in the types of problems that I'm about to describe. When you listen to the families, you listen to them tell their stories, there is an overwhelming sense of them having problems for years, causing problems for the years, and to be blunt, having a relationship with services for years. Their stories tell the history of a generation of initiatives, a generation of programs, and a generation of goals. Put bluntly, a generation of effort by many good and indeed talented and indeed hard-working people that nevertheless has failed to reach these families in a way that has actually helped them and indeed made them change. I took the time, it's part of what I do week in, week out, to listen to troubled families, and they nearly all talk about a history of physical violence and sexual abuse going back generations. The involvement of the care system in their lives, both of their parents and indeed themselves and then their children. Parents starting to have children, frankly, very young and unable to deal with them. Parents in violent relationships, the children going on to have behavioural problems, leading to exclusion from school, leading to antisocial behaviour, leading to crime. And for us today, I think we can all see the physical manifestation of all of that in the health of these problem families. You don't need to read things like the Thomas Coram report to see everything from basic health needs to chronic conditions is present. And to be honest, dare I say it in this room, you don't have to be a doctor to see the signs of poor levels of immunisation, lack of dentistry and uncorrected eyesight. Very often with poor diets leading to obesity at one end of the scale and undernourishment at the other end. About 10 years ago, I was in Sheffield. I met a young woman who was 27 years of age, and she was sleepwalking into losing her sight because of diabetes. She already had 4 children, and the only reason she was walked down to the doctors was because her family intervention worker worked out that being overweight, her type of condition she was describing, she registered her, astonishing isn't it, 3 children, 27 years of age, living in Sheffield, not registered with the GP. And because of that registration with the GP, she today has her sight. And last week I was in Gloucester on an estate, and again I just looked around at some of the young women, realising that I was sat with the grandmothers who were my age, about 30. Thanks everyone, thanks. I was sat with a grandmother in their mid to late 40s, with the daughters, with then these tiny children. They were all thin, terrible teeth and terrible hair. There's no way, I mean, I'm not a doctor, but I see the signs of health on those families every single day. And I'm not just talking about health. This isn't just your responsibility. The symptoms go much wider. There's the police dealing with endless call-outs, going back to the same address to fill out the same domestic violence report, knowing that nothing will change and they'll be back next week. There's the council getting endless neighbour complaints, making noise nuisance reports, moving towards evicting, then sending the family somewhere else, or actually the antisocial behaviour and often the neglect and the problems with the children go on and on and on. Children's social care, involved with the same family for years, taking one child of another into care as the mother repeats the same cycle over and over and over, often because she believes that it will be better next time round. We just can't go on like that. These families are the living embodiment of how the system treats the symptoms, each bit of the system coming at the problem through its own lens. Tricky territory, I understand for very good reasons. We have an obesity strategy, the 5-a-day campaign, an alcohol and awareness campaign, determined smoking cessation strategies, and I understand all of that because it's right that we're fighting diseases that are killers. So I'm not standing before you today saying any of that's wrong, but what I'm saying to you is, for these particular group of families, they don't just have one problem that's neatly addressed by a 5-a-day. In what they have not one symptom, they have multiple symptoms, multiple and complex problems, and frankly they're likely to have multiple health professionals in their lives, not only GPs, health visitors, community nurses, CAMs, and so on and so forth. So of course, put really simply for me, putting a cast on a broken arm needs to be done, no doubt about that. But if a patient's arm is broken because she's being beaten by a partner, we all know in this room in 2013 that that's simply not enough. But have we come far enough? The school will be worrying about a child's possible special educational needs. The parent will then say, he's got ADHD and we want a diagnosis of that. But if nobody actually asks about what's going on at home, the system can fail to solve the real problem. As an experienced worker put it to me, what the child was exhibiting was not ADHD. They were all the classic signs of post-traumatic distress because the house they've been living in is frankly like a war zone. The health response is likely to be medication or, if they're lucky, a referral to CAMS, but it doesn't solve the problem. The mother that I met that said to me it took her family intervention worker to phone her and come round one morning because she'd rung again saying the school's on to me, so my kid, who she described as a nightmare child, was fighting, biting, kicking and screaming in the playground and couldn't sit still in the classroom. And the worker said to her, you said to me yesterday that you and your husband are basically fighting day in, day out. Is it any surprise at all that he's rocking up at school and exhibiting exactly the behaviour that he has to live with day in, day out in your house? This is not ADHD. This is actually your responsibility as a parent to change. None of us are doing enough. None of us are doing enough to deal with what's staring us in the face when we meet these families. The misery and the dysfunction, which is the reason for many of the symptoms they walk into your surgeries with. And I believe this time around, for all sorts of reasons in 2013, we cannot treat every presenting problem without asking ourselves what's really going on for that family. We cannot sit in our surgeries or children's centres or community hubs and hope that the most in need will come. This time round, it cannot be an option to walk away if families are, I quote, hard to reach or refuse to engage, closing cases for non-attendance when they're probably the people we need to be targeting the most. I believe, and many others believe, that there is a solution to this, and it is called family intervention. It is family intervention that is able to come in under all the presenting problems and get to the heart of the dysfunction. Instead of starting with the problem or the symptom, we have to start with the family and work out from that. In a nutshell, and I'll take this quickly, it's backed up by evidence. Family intervention looks like this. It is a dedicated worker dedicated to the family, someone who the family knows by name, who goes into their home and is alongside them, challenging them and helping them to change. An assertive and challenging approach, challenging the family as well as supporting them and showing them how to change. Looking at what's really happening for the family as a whole, understanding and responding to the real problems, not just the 16-year-old that's, on some motorcycling course, the mother that needs treating for depression or on a parenting course, the 6-year-old here, looking at the whole lot together. Giving practical hands-on support, sorting out the chaos, getting a routine together, simple things like bedtime, getting up time and food on the table. And most importantly, and this is where you do come in, agreed plans and a common purpose among services. This means one family, one plan, not one plan plus a youth offending strategy, one plan plus a smoking cessation course, and one plan plus a healthy living plan. It's got to be coordinated and driven. The evidence shows this approach works. I mentioned briefly the Thomas Coram report from 2012. It shows that family intervention can and does significantly improve health outcomes, as well as other things like getting the kids to school and stopping crime. The people doing this work have to step up to the huge challenge of changing a family's intergenerational relationship with services. A quick word of warning in this modern world: don't assume that anybody with community, early years or family support in their job title, or even in your own world, they're called health visitors, community nurses or outreach workers, are necessarily able to be family intervention workers. That's a dangerous road to go down. Some, of course, will be, but the question is, can they and do they walk into the front room past the two, frankly, intimidating and huge dogs, sit down with that family and start to change that family's life? And when the door isn't open to them, they go back and they go back, and if they need to, they take somebody to open that door to make the family listen to them. These are not easy things to achieve, as hard as it is to accept. The truth is that despite all our best efforts over many years, and I include myself in that, we simply have not got this right. I visited a local authority a couple of weeks ago, and they told me about a family with 4 children. The eldest had been in care, then placed back in the home. Oddly, don't understand that, but I didn't go into that at that point. That child had their own social care team around them. The next child down was on a child protection plan, again with another social care team. The next one was designated a child in need, and that seemed to mean they referred to something the school called Starlight, and the youngest one was being monitored by something called Team Around the Child, which is essentially a monthly structure of meetings. 4 children, a minimum of 4 different social care teams from one local authority, and nobody was specifically working with the mother. So there was a sense, wasn't there, of inevitability that the children in that family would just move up and up and up till they were over a long period of their almost entire childhoods before they were being taken into care. And somewhere in that situation, there are health professionals knitted throughout those cases and that case in that local authority. At the lightest end, wondering why the mother hasn't turned up for her smoking cessation course or the food skills course, or why haven't they been for their child's follow-up injections and immunisations. To be honest, none of us can carry on with these families with business as usual, treating the symptoms, because that would fail the children in these families. And at its worst, and I can't stand here before you today and ignore this, at its most serious, you end up in the situation of serious case reviews that are currently dominating the news. None of us in the room can fail to have seen the news in the last 48 hours and to be horrified by the Bradford case of Hamza Khan, the Birmingham case published yesterday, which I read last night, of Keno Williams, and only a couple of weeks ago of Daniel Pelker. The stakes are high at the serious end, and the stakes are high, frankly, even if they don't turn up to a smoking cessation course. It is not how many assessments are made, or frankly, how many appointments are attended, or indeed appointments deferred, how many pieces of work that are done with a family that we should be valuing. We have to look for together real change in these families. So, if the police know that a particular family is the source of endless call-outs and is on the way to becoming a serious burden on the criminal justice system, the response, I say to them, has to be different to just continuing to react to 999. For local authority colleagues to have a chance to halt the need to have so many children taken into care for the right reason, or to be able to stop paying £15,000 a year for pupil referral units, if only we intervene in these families earlier and in the right way, and frankly using family intervention. For us, you in the health service, we have a chance to get to the hardest to reach families, to get to the heart of what's ailing them, and not only reduce inappropriate use of things like A&E, but actually to make an impact of some of the most costly long-term and chronic conditions that start out in your surgeries. We have a chance here, and health, I think, are alongside us as a genuine partner. Public Health England has made troubled families one of their priorities, and the Chief Executive last week was out again talking about what we can do together. In another area recently, the CCG have put in 1.5 million into actual family intervention, matching the troubled families budget. So actually when they told me that, I turned to the police and I went, so what's your contribution? What are you doing to actually take some of your neighbourhood officers and put them in the family intervention team? And you know what? They've done it. That's what partnership should be about, not monthly meetings that make us all feel good, but something much more radical. Now, you may well be thinking, and I accept this, I wish I had 1.5 million to spend. But actually, money like that is worth arguing for and worth fighting for, because spending it on family intervention is good money to spend. It gets you intervention at an earlier stage, so you can treat people in the community rather than paying for them upline with expensive hospital treatment and, frankly, chronic conditions later on down the line. So I want to leave you with a request. Of course, I want you to be supporting and indeed funding family intervention. And of course, I want you to be part of the Troubled Families programme locally. But actually today, I want to ask you for something else as well. Many of these families have never had, frankly, any positive authority figures in their lives. And they have very poor relationships with authority. Joking aside about it being an honour to speak at a GP's conference, imagine the type of power and inspiration that you have with some of the people in these families. You are revered, believe it or not. You are trusted, and you carry enormous prestige and power. Families will listen to you in ways that they won't listen to anyone else, and your voice carries enormous weight around the system. That doctor thing is enormously powerful in partnership meetings, I can assure you. So I hope that you will use the power that you have personally to bring about change. I don't believe anybody brings a child into this world, no matter what is going on in their minds, thinking and hoping that they will be a graduate from a young offenders institution. I just don't. Not a man or a woman. I just don't think that's their starting point. I've not yet a mother yet who actually doesn't want to be a good mother. They may hide it incredibly well, but actually somewhere in there with a good fit worker, we can get in and we can get them to see some light. And no, once they're turned around, they may not be perfect, no matter what all of us want in government. But they can get their kids to school every day. They don't have to commit crime and antisocial behaviour. And ladies and gentlemen, they can be healthy and lead better lives. So I hope you use the power that you have personally to bring about change. I don't think anybody is beyond help or indeed healing. And I think that is part of what makes all of us decide we want to work in the public sector and to go into things like the NHS, and certainly knowing friends of mine that are doctors to be GPs, to heal the sick, and for many of you, to help the poor. I really believe that we have here with the Troubled Families programme a unique opportunity that probably won't come again because of all the things to do with austerity and everything else. But the most important thing, Mike, is that we have the chance to give the children in these families a chance of hope, a chance of health, and actually that gives them happiness. So I hope that you will opt to be part of this. People know how to get hold of me, so do get hold of me if I can help. But I stand ready to help you if you will help the children in these families. Thank you very much indeed.